With 14-month-old Levi roaming the yard and 3-month-old Owen awake and crying, Eric and Jessica Wright's home in Fredericktown, Washington County can get pretty hectic.
2, 3.
But they wouldn't have it any other way. After all, the couple's road to becoming a family wasn't an easy one. Jessica had 2 miscarriages. After seeking the help of fertility experts, she became pregnant again.
From the get-go, everything looked really good. All my blood work was good, all my levels. From all standpoints, it looked like the pregnancy was going to be successful.
Lillian Grace was to be born in early 2011. But at 26 weeks, Jessica sensed something was wrong.
I noticed that there was a decreased movement. She had never really moved a whole lot to begin with. I would just feel flutters and some kicking, but I noticed over time that I wasn't feeling it as strong and as much anymore.
Then doctors delivered the heart-wrenching news.
So we went to the emergency room, and it was there that we found out that she had passed away in utero at 26 weeks. They basically explained to us that I would have to give birth. They did all the same things they did for any child that was alive. They took her measurements and her weight and her head circumference. We had her baptized in the hospital, and our family was all there, so they were able to meet her. We just felt it was very important to say hello before we had to say goodbye.
Jessica later learned she had factor V Leiden thrombophilia, which is a blood clotting disorder. But doctors were never able to definitely say what caused Lillian's death or what led to Jessica's miscarriages. Still wanting a family, the couple took a different route. They adopted little Levi at birth. Only a few months later, as the new family of 3 was settling in, they got some unexpected news.
And I just got this overwhelming feeling. Something said, and part of me feels that it's Lillian in heaven. She said, go take a pregnancy test. I walked inside my nice clean house with my dirty boots, and I got mud all over the floors, and I went and took a pregnancy test, and it said pregnant.
Without trying and with no medical help, Jessica was pregnant with Owen. But because of her history of having 2 miscarriages and delivering a stillborn, in addition to her thrombophilia, her pregnancy was considered high risk. So she went to see Dr. Ronald Thomas, who specializes in high-risk obstetrics and maternal-fetal medicine at the West Penn Allegheny Health System.
Our particular area deals with pregnancies that have issues or potentially have issues.
A pregnancy is considered high risk when the mother or baby develops a medical condition that causes complications. Some women have health concerns before they become pregnant.
If mom has chronic hypertension, she is by definition at greater risk. If the mom has baseline type 1 diabetes, particularly if it's poorly controlled, she's at high risk. If a patient has multiple gestation, 2, 3, 4, 5 babies, she's obviously at risk. If mom is 47, 48 and having her first pregnancy, she's certainly at increased risk.
Another issue is obesity. The Centers for Disease Control says studies suggest the heavier a woman is before she becomes pregnant, the greater her risk of pregnancy complications.
If the mom is young enough and has a huge weight issue, getting that weight issue under control before she becomes pregnant is a big deal.
Here, can you see the heart?
Getting care before you become pregnant is key. Michelle Frenier is State Communications Director for the March of Dimes. The organization helps women to have healthier babies through education and research.
When a woman plans a pregnancy, if she does have any health concerns, she can get those kind of all taken care of or addressed early.
There are also complications that arise during pregnancy. Issues such as anemia, gestational diabetes, preeclampsia, which is pregnancy-induced high blood pressure, and hyperemesis gravidarum, also known as severe morning sickness.
If you recognize that you've got something that's half a bubble off level, that's just a little bit abnormal, there are, in most cases, things we can do to improve the outcome or maximize the outcome under not the best of circumstances.
Another pregnancy complication is preterm labor, which is labor occurring anytime before 37 weeks. The CDC says preterm birth is the most frequent cause of infant death, and premature babies are more susceptible to health problems and longer hospital stays. In many cases, doctors don't know why preterm labor happens.
A significant portion of those patients arrive with early rupture of membranes and bag of waters breaks, and infection becomes a risk. And it's a question of keeping the baby in prematurely as long as you can.
Once doctors determine a woman's pregnancy to be high risk, a typical course of action includes additional doctor's visits.
And there's probably some value to providing those patients the feedback every 2 weeks or so that they're doing the right thing and they can continue to do that, and it's going to be a positive, encourage a positive result.
Whoa!
For Jessica, once she got to 26 weeks with Owen, she had a non-stress test and an ultrasound alternating every other week.
And in those patients, what you're concerned about is the growth of a baby, more than chromosomal abnormality. Those women, what you concern is the placenta, if is it forming correctly, and if they're going to deliver the baby early.
There were so many signs that I had with Owen that I didn't have with Lillian that we should be hopeful. When I started feeling Owen move and feeling him literally, I think, beat me up from the inside, it was the most glorious feeling ever.
One thing the Wrights did after Lillian's death was turn to the March of Dimes. The group has an extensive website with pregnancy information and research, including a feature called Ask Us, where a woman can type in her question and get an answer from a medical professional. It's completely confidential.
Maybe she has a concern. Gee, should I color my hair? Or I'm concerned that my doctor is concerned about my blood pressure. What does this mean?
The March of Dimes also helped Eric and Jessica keep Lillian's memory alive.
We started Lillian's Legs for Life family team with the March of Dimes, March for Babies, Washington County Walk, in hopes that anyone that might be pregnant or was pregnant would kind of have an idea that sometimes things don't go the way that you think they're going to go, and that there are places out there that can offer support.
The couple says they couldn't have gone through what they did without the love and support of their family, friends, and faith.
I'm a firm believer that this was God's plan, but I know if Lillian had not been in our lives and we had not had the opportunity, that we would not have Levi here today.